So that's what's next for the NPP going into the 2016 polls. A conversation between Nico Tate-Jani, Nana Henento, aide to Alan Tremonte, and Mustafa Hamid, aide to Nana Addo Dankwa Akufo-Addo. Move on to some other issues. 8 labor unions have served notice they will embark on an indefinite strike on Tuesday, October 21, to protest government's failure to pay public service workers their tier 2 pension funds into a private account. The unions have also decided to lay down their tools despite the lack of support from the Trade Union Congress, because according to them, the TUC has betrayed them by failing to press home their demands. The 8 unions are made up of the Coalition of Concerned Teachers, the Ghana National Association of Teachers, National Association of Graduate Teachers, Public and Health Workers Union, and the Ghana Registered Nurses Association. The rest are the Government Hospital Pharmacists Association, Ghana Medical Association, and the Civil and Local Government Staff Association. Dr. Justice Yankson is Deputy General Secretary for the Ghana Medical Association. He's joined us over the telephone. Doc, you're welcome to the program.
Thank you.
What exactly happened after the last 2 meetings?
Well, basically, workers in the public sector of our economy in particular have over the last 2 to 3 years engaged government on all fronts to sort out this second-tier pension scheme mess that we find ourselves in. Unfortunately, it looks like government's approach has been rather lackadaisical, and we've arrived at a point where workers who are retiring come January don't have any idea who to go to for their lump sum tier 2 benefit or how much has even accrued to them. And that is the more reason why over the last 4 months we've engaged government intensively wanting a solution. Unfortunately, it looks like government doesn't want to allow the schemes to operate, let alone pay our monthly contributions into the scheme account for them to grow those amounts that basically serve as our investment. So we've gotten to the point where the workers are saying they've had enough. They don't get any ex gratia after their 40, 20, 35 years of service to the public sector of Ghana. All they depend on is the paltry amount they get from their pensions. So if pensions per se are also not going to be handled properly, such that they now face the prospect of going home with nothing, then they will have all kinds of problems as they retire. Mind you, there are no social protections for pensioners in this country, basically, except the pension. So that is where we are now. The workers are saying they've had enough. They want government to resolve the issues. Government should listen to them, else there could be chaos in the system.
Doc, let's get an understanding of the matter. Is it that there is no agreement on this private company that should take care of their tier 2 pension deduction, or it is that government has delayed in paying into this private pension manager?
Okay. The issues are simple. The various workers within the public sector, together with their management, have formed schemes. At least we can talk about 4 major schemes: that of the health service, that of the Ghana education service, that of civil service, local government, and then that of the judiciary. Now, what the workers, who technically speaking are the beneficiaries and whose name these amounts that are deducted actually invest once they are paid, it's so basic that they think they should have a say in the management of their funds. So once they form the schemes, which were duly licensed and approved by the National Pension Regulatory Authority, the next line of action was for government to actually release the funds and also pay the monthly contributions that were going to accrue in the months to come. The law also says that within 3 months of formation of the schemes, the money should be released. These schemes have been in operation or were formed more than 2 years ago in some cases, and government has still not paid the money, flouting the laws of the land. At the same time, not also paying the monthly contributions that are accruing as we speak. So this is the situation. Government, on the other hand, at some point wanted to impose a privately owned company to manage the funds for the employees. And the employees are saying, no, this is our funds. We want to have a say in it. You cannot bring an entirely private company who we don't know what can happen to our money in case they decide to do what is wrong. Government still insists that, look, it is that private company or national. And this has been one of the issues to date. And now the workers have resolved that, look, the money belongs to us. It is not for government. And we want to have a say in how it is run. And government should also respect the laws of the land.
But the labor unions have had conversations with government since this issue started coming up. What exactly did government say it would do?
Well, government posture has been simple. I am not releasing the funds. Else they should have released the funds up to now. Government has always insisted that a particular private company is what they basically will accept to manage the funds for the workers. And the workers are saying, no, this is our money. The monies don't belong to you. They are property per the law. The money vests in us once they are deducted from our salary. So you cannot say you want to run it the way you want and give it to a private company that the workers are not comfortable with. Meanwhile, the law even allows the workers the right to transfer or put their money if they think that a particular manager is not handling their issues well. All this goes to show that the workers should have control over what is done with those money.
Now that the decision is to embark on strike, if government refuses to pay into those schemes, within the Ghana Medical Association, which services are we to expect will be withdrawn from tomorrow?
Well, as we speak, we as Ghana Medical Association haven't come out to say we are going on strike. All we said is that whatever the bigger group decides, we will be a part of it. I know the bigger group hasn't spoken. Very soon, a formal communication will be released.
Dr. Yankson, when you said a bigger group, how do you mean?
The bigger group, i.e., the workers within the health service, together with those in education, those in the judiciary, those in the civil service, local government. That is what I mean by the bigger group.
What we hear now is all of these groups you have mentioned are saying tomorrow, Tuesday, October 21, they're starting their strike.
Well, assuming they start tomorrow, rest assured that the Ghana Medical Association, we wouldn't go back on our words. We have said whatever decision the bigger group takes, will be a part of it because we are equally affected. And two, we will then come out with modalities as to what we will be doing as a group. But we are definitely going to be a part of any decision taken by the bigger body.
But the mention of the bigger group, though, one would imagine you'd be referring to the Trade Union Congress.
Well, the issue is this. You know, the Trade Unions Congress, it's a body that I think a lot of people don't seem to appreciate who are their members. They have a lot of private sector, quasi-governmental sector workers within their fold. Now, for those in the private sector, if let's say somebody is part of, say, the communications union and all that, they are part of the TUC. They may not have the same problems as the workers in the public service are having now. GMA is not part of TUC, but GMA is part of organized labor, which is made up of both public and private sector employees. So this issue, technically speaking, is not the mandate of TUC. A few of our members, especially the Health Services Workers Union, they are also an offshoot or a part of TUC. But that is just a small fraction of the bigger TUC. So what is happening, technically speaking, is that these workers who have decided to embark on whatever action that will be announced are people who are in the public and civil services of Ghana. Not all of them belong to the TUC. A small fraction form part of TUC, but majority are not members of TUC. Basically, that is what is happening.
So, Dr. Yankson, what I'm supposed to understand now is the fact that individually, this pension issue has been negotiated on that level. That is how individual labor unions have negotiated with government.
Not exactly. All these groups that we've spoken about, all the unions in the public services, like I mentioned, education, health, civil service, local government, judiciary, they have come together as one group and spoken with government all this while.
I see.
On the other front, organized labor, which includes TUC and all the other affiliates, have also had cause to complain to government about the improper management of the Tier 2 funds. And 3, at the last national demonstration that was organized by the leadership of organized labor, actually insisted that government pay heed to the cry of workers and ensure that the right things are done for the Tier 2 funds. So this is a call that virtually all the workers in Ghana are saying, look, they are not happy with the way Tier 2 funds are being managed, especially the contributions from the public sector, and government should come to the table and ensure that the right thing is done.
I see. We'll leave it here for now. Thank you very much, Dr. Yankson.
You're welcome.
Dr. Justice Yankson is Deputy General Secretary for the Ghana Medical Association. He says that whichever decision is taken by the rest of the 7 labor unions, the GMA will follow suit with it.